With Good Morning Kenya. My name is Jain, Wambui, and right now we want to move on to our health segment. And today we're going to be focusing on the state of oxygen, its supply, its capacity, among many other aspects here in our country. And to help us with this conversation, with us in studio, we have Philip Nyabera, who is the CEO of Lifebank Kenya. Good morning, sir, and karibu sana.
Good morning. Thank you very much.
Thank you for making time to be with us today.
It's a pleasure.
Fantastic. Let us just jump straight into it, and let us start by understanding, what Lifebank Kenya as an organization is all about before we get to the details about oxygen in Kenya.
Okay, so I think to start off, I'll just like to tell you what Lifebank does.
Yes.
In totality. So Lifebank is a technology company that delivers quality healthcare to patients in emerging markets and sub-Saharan Africa. So currently we are in Kenya, Nigeria, Ethiopia, and looking to be Pan-African very soon. So basically how we do this is we are able to match and use our distribution platforms and infrastructure to be able to meet the demand that is actually in the healthcare industry, and we do this by our different multimodal ways.
Yes.
And through this we are able to move critical products like blood, oxygen, and medical consumables. So we have names for these products. So like for medical oxygen we call it Airbank, as our name states, Lifebank. So normally our products have that bank. Yeah, so basically it's a bank of products.
Yes.
So we have Airbank that does our medical oxygen. Then we have Stockbank that does our medical consumables. Then we have Lifebank that really handles now the blood segment.
All right.
Yeah.
And what does it take for you as an organization to be able to make sure that you have access to these products, looking at the oxygen, the blood, and other medical consumables, to make sure that you have access to them and you can store them for the time that you need to, and also ensure that they are readily available for those who may need them at their point of need?
So normally different products have different ways of handling them, and it's a complex way of doing so.
Simplified for us.
Yeah, because you find that every product has different ways of making sure that it's basically available for hospitals to use. So like, I'll start off by saying, let's say oxygen.
Yes.
So what we do for oxygen, we aggregate demand. So basically we work with different partners to be able to make sure that the demand is available for hospitals to use. Okay. And this is that we have partnered with a lot of medical oxygen producers to be able to make sure that we can be able to have enough and readily available oxygen for hospitals and healthcare facilities to use. So that makes us have different stations at the producer's plant where we can be able to keep our cylinders, and also make sure that that is actualized so that whenever any hospital is in need, we can always rush and make sure that we use the producer that is close to where the hospitals are. Okay. Yeah.
And let us just pick up on that particular point and of oxygen, because oxygen has all of a sudden become such a vital commodity. But let's go prior to the pandemic. What was the situation when it comes to the demand that you are experiencing as an organization in the acquisition and distribution, demand versus supply before the pandemic? How was that looking like?
So initially, if you look at the stats, initially the country or the nation only needed about 410 tons of oxygen. A year, yeah. Yes. But this grew. I think by January 2021, we saw it went to about 550 because of the COVID pandemic. So I think the COVID pandemic really exacerbated the rise in the use of oxygen. And we find that even in August, where we had the Delta variant, it was peak, because we were seeing the numbers grow to about 1,000 in terms of tonnage for oxygen. So this was huge, and it really...
That is more than double the...
It was more than double.
Yearly requirement.
Yes. So this really stretched hospitals and healthcare facilities, because you find that hospitals that were using, let's say, 2 cylinders a day had now increased their use to about 20 cylinders. Some that were using 20 and were now using more than 100 cylinders. And you find that this is a capital intensive initiative where no one will just store cylinders for the sake of such an emergency. So you find that systems were stretched, the infrastructure was stretched, and that's how Lifebank we came in. So we came in during the COVID pandemic, and we were able to assist hospitals to be able to meet that demand, because it was really critical for patients to be able to access supplemental oxygen oxygen, and also those that were discharged. There's some that were discharged to recuperate from home. We also offered an infrastructure for them to get oxygen at home also.
Okay. Yeah. And speaking of those infrastructures, we even did see the CS coming out to say there are people who are hoarding oxygen tanks that are needed at some of these production plants to ensure that most of the public hospitals get the oxygen that they need because there was an acute shortage. But let's talk a bit about those infrastructures that, come along with oxygen. How much does it cost to acquire an oxygen tank without the oxygen?
So normally it ranges because it's an expensive process.
Yes.
You have to go check on the best suppliers abroad because I've not seen any local manufacturer for now. So we always have to go and check abroad on how that can be arranged. So normally they range between 32,000 Kenyan shillings to 50,000 Kenyan shillings to get at one oxygen tank in Kenya.
And what capacity, for the benefit of our viewers?
So it depends. So it varies. There are different capacities. There's 1.36 meters cubic, the smaller one. Then there's the 8.5, the bigger one. So you find that the bigger one mostly is the most commonly used in hospitals. So that now is what that one is what costs about 50,000 Kenyan shillings.
All right. Yeah. And are those the figures before the pandemic, the regular price range that we were seeing, or how did they shift during the pandemic? So
before pandemic, those cylinders used to cost about 18 to 20,000 Kenyan shillings. But now because of the pandemic and the world at large was suffering from this, so I think the demand was too huge, and the market forces really forced that to happen, and the cost went up significantly to about 50,000. Kenyan shillings. So it's about more than double the price. More than double. Yeah.
And that also is the same situation with now the actual liquid gas that is filled in these cylinders.
Sure. So during the critical times, let's say, let me give an example. During the Delta variant times, we saw that initially to refill an oxygen tank was about 2,000 shillings, but that went up to about 6,500 based on the different plans that are available. You see, that's a very significant rise. And for a patient in critical care, needed about 3 cylinders a day. So imagine how much that patient had to part. So you find that oxygen therapy was among the most expensive aspects of managing COVID-19. So hospitals were overstretched in terms of supply. Patients were being overcharged because the commodity was also very rare to find in the market.
All right.
And the plants that were available to produce this were also really stretched in terms of the different customers that they serve and how the urgency was there to be able to make sure that every patient is saved during this period.
All right. Yeah. Now, from my understanding, I know we have about 73 plants in the country for oxygen production. And when it comes to this whole aspect of Kenyans hoarding some of these oxygen cylinders, among many other hospitals, not just the common mwananchi, we also, and this is something that I've also seen, we have seen some of these oxygen cylinders converted into industrial use, among many other uses. How can such issues be addressed to make sure that these oxygen tanks are taken back to where they need to be, and especially at the plants to ensure that they're given back or either circulated back to the hospitals and to individuals that need them? And especially looking at the common mwananchi, the bigger chunk of this whole conversation.
So the biggest challenge with the industry on cylinders is not only hoarding. So there's this aspect of where people steal oxygen cylinders and they are able to transform them into into industrial oxygen canisters, because you see every cylinder has a different way of how they're labeled. So medical oxygen, you'll always find it has a white band at the neck, then it's totally black.
The cylinder itself is black and has a white band around the neck. Okay.
But now every other gas has a different color coding for the same. So you find that normally these oxygen cylinders are available, but you find that during those times when we don't have any pandemic or we don't have any need for them, you find that people always try to devise ways of how they can be able to meet their other demands through that, and end up stealing these cylinders and converting them. So that's the biggest issue. And I thank the authorities for always cracking them down and making sure that they're able to find those places where they hoard these cylinders, and they're able now to transform them back to make sure that that need that they actually were created for, they can be able to meet that demand.
Okay.
Yeah. Sure.
And what does it take to transport oxygen, given you are part of the, part of the value chain that ensures you get it from the source to the point of need? How does that look like for you as an organization?
So the logistics for oxygen vary. So there are the small canisters for home care and emergency cases, for ambulances and so. And there's that huge canister, about the 8.5, that requires, it's quite bulky, and it weighs about 50 when empty. So when filled up, it's a bit more in terms of weight. So you find that handling these cylinders is quite always a challenge, but we've been able to devise a way of making sure that these cylinders get to the refillers at the right time, and always we make it a rotation kind of model where we have cylinders already filled, and when we get there, they're already waiting to be loaded, and we offload the empty canisters because we work around a scheduled model. Normally before COVID, we used to do a scheduled model. Normally, that's what happens in the industry. But with COVID, you find that the stretch really brought about more of emergency than
unprecedented.
Yes, than scheduled. So you find that for those emergency cases at home, for those emergency cases in the ambulances, we have our tricycle and motorcycles. They're able to transport that fast because we find that the traffic scenario in our country is quite bad. So you find sometimes you're stuck in traffic with a truck and cannot be able to get to the end point at the right time. So we use tricycles and motorcycles to be able to get to that patient as fast as possible so that their life can be saved. But for those big canisters, we still depend on the huge trucks to be able to transport that. And that takes time because you find that trip all the way to the refillers or the aggregated warehouse, you find that it takes a bit of time, but we always make sure that we are able to deliver below 2 hours so that we can make sure that those hospitals can be able to cater for those patients without failure or losing lives.
All right. And in terms of, the policies and regulations that govern, of course, the country, and of course, given you're part of the value chain, do they create an enabling environment to ensure that you are able to conduct business and ensure you are giving as best as you can, the best that you can rather, to those that need this medical consumables and some of these vital products at their point of need?
Yeah, so I think currently the regulations are quite okay for now.
Okay.
Yeah, I can say that because we still have a long way to go.
Yes.
I think one thing that is really a challenge is where we have the private sector inclusion. You find that most of the healthcare system is always government and public sector influenced most of the time, and you find that private sectors working in these areas really have to go a long way to be able just to meet the standard. So I think private sector inclusion is quite key, and in terms of making sure that they're well regulated to be able to offer services, like let's say for blood and blood products, that is an area where we really need private sector included, and the regulations need to really be watertight so that no wrongdoing can be subjected in such a manner that will be able to cause that industry to look bad. But we are looking upon, because there are current regulation frameworks that are currently ongoing. There is a bill in Parliament that is still undergoing the process, and we hope that will pass soon, and we'll be able to see more of private sector in that area. But for oxygen, I think that is still well regulated, and as you all know, that the biggest requirement for oxygen is to make sure that the oxygen is transported in the right manner, in the right condition, so that it does not cause danger or more harm than good. Yeah, because those are always like bombs waiting to explode. Yeah,
it's oxygen.
It's oxygen. So the critical transportation is really key, and there are regulations for that, and everyone doing that is always taken through the right process to make sure that they comply, so that before you start handling such a business.
And that actually brings me to now the practitioners and the personnel that are involved when it comes to the handling of this very delicate products, medical products for that matter, because that is also another area that we all know there have been many loopholes in the past. We have had quacks who have masqueraded and caused people to lose their lives. When it comes to also ensuring that the professionals are actually the ones that are handling this oxygen that is received, they are administering it in the right quantities, and ensuring that the proper steps are followed when it comes to oxygen, the blood, and other medical consumables. From where you stand, how can that also be ensured that it's on the right track to seal these loopholes that do exist there?
So I think one of the best things to be done is the vetting process when every stakeholder is taking to employ. So there's always a very watertight vetting process that needs to be done. Like for us, the people who work for us, they're actually qualified personnel who are actually qualified to handle the different products that we deal with.
Yes.
Like for blood, we have qualified lab technologists, and for oxygen we have qualified staff who've really handled that before. And for medical consumables, as you will know, it's something that is quite not really in terms of needs a lot of knowledge and information to handle, but we have people who are well able to be able to handle that and provide critical care whenever is needed, so that these products get to the hospitals in the right condition. Because one thing is this, normally what we always believe at Lifebank is this, we are able to save lives through our different initiatives. So getting this commodity to the hospitals or healthcare facilities at the right condition is one of the greatest things. Because if you are able to handle, let's say, oxygen not in the best way possible, it will get to the hospital, and if you drop the canister, it explodes. So they are very keen processes that needs to be employed to make sure that that process is seamless and it's actualized to make sure that everyone is safe. That is one of the biggest points that needs to be underlined. So it's safety first.
Yes.
Then it can now go and now do the actual
task that
is supposed to do. Yeah, exactly.
All right. Now, as we draw nearer to the close of this conversation, in terms of adjusting to the pandemic, because that just brought a whole reality to the entire global population when it comes to our capacity, first of all, as a country, to ensure that demand is somewhere close to meeting the supply, or rather the supply is somewhere close to meeting the demand that we need as a country, and also you as part of the value chain ensuring that you are at your best capacity, because the environment does allow for you to operate at your best capacity, and the personnel are also, towing the line and at their best capacity. Taking a step back and looking at the bigger picture, how can we improve capacity at all points of interaction?
So COVID-19 has really given us it's an eye-opener for everyone.
Reality check.
Yeah, it's a reality check, because no one knew how we will be able to evolve this much. And I can congratulate everyone who has been in this, because they've really tried. They've learned through the process, and we can be able to tell that we are seeing a significant change in how preparedness and how we can prepare for disasters coming our way. So I think moving forward, we are able to see that demand has gone down for now, because COVID cases have gone down. Vaccination currently, the drive for vaccination is helping, and we can tell that with this kind of preparedness, we will be able to see that number go down. But one thing I can say is this: there's one point where we never used to know the exact how oxygen therapy is administered, but with COVID-19 it has really helped a lot. Even the health workers, now they know the exact levels to administer oxygen. So initially it was just here and there, but now at least everyone in the healthcare industry knows when to administer oxygen, and the demand has also the demand now for oxygen has not only gone down, but it has made sure that everyone now understands the best care or best practices to be done for oxygen therapy, and that makes sure that the preparedness for the same in terms of hospitals building capacity, the government building also putting aside a lot of budgetary allocations to be able to meet such, and I think the government also has a very big part in this, because they have done a lot of improvements to public sector, hospitals and other facilities. So they have put up oxygen tanks, and they are able to monitor that by the day, so that they can now be able to meet that demand. Because initially, it was everyone on their own, and
each
God for us
for
all.
Itself,
But for now, we can say that the preparedness is on a different notch, and the worst of it all was in July, August, when we were going through the Delta variant. But we've seen that if we conquered that and putting in place the different oxygen plants that are being set up in the country, we've seen, like, currently, as you said, there are 73 plants, but they are growing. There are some still in construction. There are some cylinders that are still, like, the other day I received a consignment of cylinders from abroad, and that is just in place to be able to beef up that capacity that we have. Because initially, there's a point where we exhausted all our infrastructures, because there was no more cylinders to issue to healthcare facilities, and that was really a big problem. But now we've been able to beef up that capacity to make sure that the technology to predict demand, that we've already now initiated that, and we have also initiated cylinders and also increased in our capacity to deliver that same. So we've done that in that short process, so that we can be able to be ready for the next, prepare for anything that will come our way in the next coming days.
All right. And very briefly also, when it comes to civil education and just creating awareness among the population, because arguably so, I would understand someone who'd want to keep this cylinder and make sure I will hoard these 3 to just make sure I have 2 months down the line, I still have the supply I need for my loved one or for myself, in order to just create awareness on the importance of understanding that this cylinder is needed there to make sure that I have another one 3 months down the line should the need arise. Very briefly.
So very briefly, I would like to say this, that we should not only have selfish gains for ourselves, we should always look to save other people's lives as well. Because if you save 3 canisters and you only need 1, that means that you're being selfish. And it's not a good virtue. All of us are Kenyans, we love each other, and we will not love to see any other Kenyan suffer because you were selfish and kept some cylinders for yourself. So for me, I'll just like to tell every Kenyan that whenever you have such surplus, please give out for the rest to be able to also get services, because it's not good to see our neighbors suffer while we have supply that can be able to sustain their lives. So we always like at Lifebank, we always say we're in the business of saving lives. So I believe that every Kenyan should be in the business of saving lives. So if you have a canister that you're not using, please surrender it so that it can be used to refill and save another person's life.
All right.
Yeah, sure.
Of course, we are in line to getting to that point where, as a country, we have the capacity to ensure that a Kenyan doesn't have to worry that if I give out these cylinders, I won't have the oxygen I need a few months down the line. So this goes in line with supply meeting the demand. All right. That is all the time we had for this conversation. We have been speaking with Philip Nyabera, who is the CEO of Lifebank Kenya, all about the state of oxygen and particularly looking at the deficiencies that we have experienced prior to the pandemic, during the pandemic, and now the lessons that we are carrying forward with us as we, increase capacity in all areas, possibly so. Thank you so much for making time to be with us.
You're welcome.
All right.
Thank you very much.
That is that in terms of Good Morning Kenya. Thank you so much for being with us. My name is Jain. Do enjoy the rest of your viewing. See you tomorrow.